So what would I say to a nurse practitioner who's thinking about being a preceptor? I would say go for it. It's a lot of fun. It can be scary at first because you feel like I'm kind of new, maybe I don't know enough to help a student, but actually you do. You know so much, and students really appreciate the time you give them, and you will learn right along with them, side by side with them, and there's plenty of resources to help you be a good preceptor.
Yeah. I would say that the University of Minnesota has been a great institution to work with. I found that the clinical instructors and the faculty is very responsive to any questions or concerns I've had. I felt very supported as a preceptor. I felt like I've always had the right people to contact if I had any issues with students. And I've just felt the whole organization has been very supportive as me as a preceptor and being available for any help that I needed.
I love what students bring to the clinical setting. They bring lots of great questions. They help me learn. We learn together. It's good for the patients. The patients always love that engagement of I'm helping someone else learn, and I always ask their permission. Is it okay if I have a student with me? Is it okay if they talk with you? And they just love that interaction. As students get farther along in the program, it really is a help and a joy to work with them. I'm not saying it's not a joy to work with the younger ones, but it just gets easier and easier the farther they get along. And I love seeing the progress the students make in those roles.
I find it rewarding to see the growth and the self-confidence that they gain over the semester, and where they can develop that plan and very definitive give a diagnosis. I think that's just very rewarding. Patients actually enjoy my students. They give me a report when I go in to talk to them after the student's been in there, and they evaluate the students for me. I think being a preceptor does make me valuable in my job. It keeps me, number one, up to date, but also it helps stimulate me and learning the new things that they're learning, and I like mentoring and encouraging people.
I think the most valuable thing in becoming a preceptor is that we have an obligation to train the future. There's a quote that I often kind of think about when people ask, why do I like to teach so much? And it's, I teach because I was taught. And the only way that we will ensure the future of good healthcare providers or ensure that we have safe practitioners moving forward is to take the time to train them and to train them well. And yes, it takes a lot of extra effort, and yes, it is a sacrifice on preceptors' parts, but it's very rewarding, and you're doing your part to ensure that your granddaughter will have a nurse midwife, or your granddaughter will have a great nurse practitioner to take care of them, just as you have had, or your grandmother before you.